Uterine fibroids, also known as leiomyomas or myomas, are noncancerous growths that develop in the muscular wall of the uterus. They are one of the most common reproductive health issues affecting people with uteruses. While they are often referred to as tumors, they are typically benign growths and are not cancerous. Fibroids can vary in size, location, and number. Some may be small and go unnoticed, while others can grow quite large and cause significant discomfort and symptoms. The effects of fibroids on fertility can vary depending on their size, location, and number. Small fibroids that do not distort the uterine cavity are generally less likely to impact fertility. However, larger fibroids or those that affect the shape of the uterus or block the fallopian tubes can potentially interfere with conception and pregnancy. Additionally, fibroids can sometimes lead to miscarriages or complications during pregnancy, such as preterm labor. Causes of uterine fibroids. The exact cause of uterine fibroids is not fully understood, but several factors may contribute to their development. These include: 1. Hormones, estrogen and progesterone influence fibroid growth. 2. Genetics. Family history and genetic factors can contribute. 3. Race and ethnicity. Certain groups, like African Americans, have a higher risk. 4. Obesity. Being overweight can increase the risk. 5. Diet. Poor dietary habits, especially low fruit and vegetable intake, may play a role. Signs and symptoms of uterine fibroids. 1. Heavy menstrual bleeding, excessive or prolonged periods. 2. Pelvic pain, discomfort or pain in the pelvic region. 3. Pressure and pain, feeling of pressure, sometimes accompanied by pain. 4. Frequent urination, needing to urinate often. 5. Constipation, difficulty with bowel movements. 6. Enlarged abdomen, swelling or visible enlargement of the abdomen. 7. Anemia, fatigue, weakness, and dizziness due to low red blood cell count. 8. Painful intercourse, pain during sexual intercourse. 9. Reproductive issues, infertility, miscarriages, or pregnancy complications due to fibroids. The severity and presence of these symptoms can vary from person to person. If you're experiencing any of these signs or symptoms, consult a healthcare provider for appropriate evaluation and guidance. Treatment options for uterine fibroids depend on the severity of symptoms, the patient's age, and the desire for future fertility. Some treatment options include: 1. Watchful waiting. If the fibroids are small and not causing significant symptoms, a doctor might recommend monitoring the fibroids without immediate intervention. 2. Medications. Hormonal medications, such as birth control pills or GnRH agonists, can help shrink fibroids and manage symptoms. However, these are usually temporary solutions and may not address the underlying issue. 3. Minimally invasive procedures. Procedures like uterine artery embolization, myomectomy, removal of the fibroids while leaving the uterus intact, and focused ultrasound surgery can be used to treat fibroids while preserving fertility. 4. Surgical options. In cases where fertility is not a concern and symptoms are severe, a hysterectomy, removal of the uterus, may be considered as a definitive treatment. 5. Fertility treatments. In some cases, assisted reproductive technologies such as in vitro fertilization, IVF, may be used to bypass fertility issues caused by fibroids. It's important for individuals with fibroids to consult with a healthcare provider to discuss their specific situation and determine the most appropriate treatment plan. If fertility is a concern, seeking care from a reproductive endocrinologist or fertility specialist can provide specialized guidance on managing fibroids while maximizing the chances of conception and a healthy pregnancy. Subscribe us to stay updated.